the reality is, because a lot of us work in the emergency profession, it's 24/7. We can't all work 9 to 5.
And so I oftentimes think about, I don't think this patient is going to do very well if I'm not doing very well.
And so what we really have here is a sort of a slippery slope of psychological distress.
Definitely need to have the caregiver mentality.
Yes.
And that I know is definitely a risk. And you need to be really aware when you're in a caregiver position.
Yeah.
And like you said, the caregiver professions.
Yeah, and I think it's specifically for compassion fatigue. You know, you can't put yourself in the place and face of suffering without having a human response, because we're human beings doing really difficult work. So compassion fatigue is something that we should all be educating each other about and be aware of how it manifests in us and in our teams.
Proper sleep hygiene. So when it does come time to leaving your shift in the morning and going to bed, how can you best do that? When should you be going to bed? What can help you go to sleep? How do you set the stage in your bedroom to accommodate that? Are there supplements that can help? And things like nutrition, incorporating meditation, exercise, all of these things that set ourselves up for success.
And being able to recognize early warning signals, being able to have really open conversation with colleagues about when we are really struggling and what kind of support we have and what we need to better cope is critical.
So that's just finding it within yourself to muster up and say, I need some help, because I'm not serving this patient well, and I need to go take 5.
You know, all of us work so very hard and are brought to this profession with nothing but passion and a desire to be of service, and ultimately that undergirds everything that we do. And I think if I could say one thing to my veterinary colleagues, it would be, you can't serve from an empty vessel. So we have to be doing a better job of caring for ourselves so that we have all of our best tools on board. And that is the best service we can do to our clients and patients.